Thank you, Dr. Nadika, keeping up to time. It was eye-opening presentation on male involvement where there is a knowledge gap, though the attitudes are good. Over to you, Roshan.
The next presentation is on unraveling the factors determining traditional family planning practice among ever married women in Sri Lanka. This is by Migara Karunaratne, who is a senior lecturer attached to the Department of Demography, Faculty of Arts, University of Colombo. Currently, he serves as the treasurer of the Population Association of Sri Lanka. He obtained his Master of Science degree in Business Statistics from the University of Moratuwa and Bachelor's degree from the University of Colombo. His key research areas are sexual and reproductive health, LGBTQ+, community-related health and well-being, and demographics of minority groups. Over to you, Migara.
So thank you very much. Very good afternoon to you all. So today I'm going to talk about the unrevealing factors determining traditional family planning practices among ever married women in Sri Lanka. As they explained me, I am Migara Karunaratne, so I am attached to the Department of Demography, Faculty of Arts. When it comes to the introduction, effective family planning is influential in improving the well-being of both the mother and child. So as we all know that most of the families or couples are using birth controls or family planning to delay or spacing or limiting their childbirth. Globally, according to WHO, the family planning eliminates 1/3 of the deaths related to the pregnancy and nearly 45% of neonatal deaths. This is due to the suitable family planning interventions in timing and spacing of the pregnancies. However, compared to the modern methods, we all know that the traditional family planning methods failure rate is quite high than the modern methods. So we all know that in generally we are practicing both methods in Sri Lanka. So notably, it is important to emphasize that Sri Lanka has been documented as one of the nations with highly who depend on traditional family planning methods according to the Ministry of Health in 2019. Nevertheless, still the motives for that or the usage of traditional methods have been not investigated statistically. So with that kind of objective introduction, so my main objective of the study is to identify and modeling the significant or influencing factors which affect on practices of traditional family planning methods among ever married women in Sri Lanka. With regard to that, my methodology was taken. I have taken the data from by using secondary data, which data collected by the Department of Census and Statistics for the Demographic and Health Survey, which was conducted in 2016. So this is the latest Demographic and Health Survey which was conducted in Sri Lanka. This is the up-to-date data which I can take from the DCS. Sample size were 10,835 ever married women. The technique was I used binary logistic regression model for incorporate to identify what are the factors which affect on traditional family planning practices. Dependent variable was traditional family planning users and modern family planning users. Independent variables were selected under 3 categories as demographic, socioeconomic and programmatic factors. When it comes to my explanation with regard to how I assess the knowledge of family planning, there were several questions. There were 12 questions asked at the Demographic and Health Survey which regard to the knowledge. So according to them, I have scored them as 1 for the correct answers and 0 for the wrong answers. Out of that, I have scored and divide into 3 categories and good, moderate and poor knowledge. When it comes to the results, so I will briefly explain about demographic, socioeconomic background and their differences about the respondents by traditional family planning methods and modern family planning methods. According to the distribution of their ethnic characteristics, you can see there are no such a huge difference. But when it comes to the quintile of the respondents, you can see the highest of the who belongs to the highest wealth quintile are using traditional family planning methods than the modern methods. When it comes to the employment level of the women, the ever married women, you can see in these last two occupational categories, you can see highest percentage than the modern family planning users belongs to the quite higher levels of employment categories, those who are using traditional family planning method. And also when it comes to the age distribution of the traditional family planning users, you can see quite higher percentage than the modern family planning users in quite higher age categories, especially in 33 to 41 and 45 to 50 years of women. And also when talking about the sectoral distribution of the respondents, you can see quite urban women are having high proportion to using traditional family planning methods than the rural respondents. But when it comes to state sector, you can see higher modern methods usage among state sector women. And also when it comes comes to the distribution of number of children among those users, you can see the majority, quite higher percentage can be seen among those who are within childless women using traditional family planning methods than the other two categories. This is the main outcome of my research. So according to regression analysis, I have identified, according to my basic three subcategories, according to the logistic regression model, the predictive power of the model is 82.9%. Among that demographic factors, knowledge on family planning, women's ethnicity, decision to use family planning, women's religion, women's age and their education level, and also the number of children are affect for their traditional family planning usage. And also under the socioeconomic category, occupation of the spouse as well as occupation of women and wealth quantiles are highly effect on traditional family planning usage, and also which belongs to the programmatic factors, attending to well women clinics and taking advices from public health midwives are effect on traditional family planning usage. So this is the final model I took from the regression analysis. So when it comes to the odds ratio analysis, you can see actually I am talking only few points because due to the time. So odds of the practices of traditional family planning is 2.6 times and 1.33 times high respectively among women, those who have moderate knowledge and good knowledge than the poor knowledge on family planning methods. So with having some sort of a good knowledge means that they are trying to use traditional family planning methods than the modern method. And also when it comes to the decision to use family planning methods taken by both together is 4.26 times higher than the decision those who are taken by taking advice from the midwives. And also odds of practices on traditional family planning are 1.88 times and 2.33 times and 1.48 times advanced respectively among women who are in the age group of 23 to 32, 33 to 41 and 42 to 50 years than the who are in the below lowest age groups in the Sri Lankan ever married women's category. And also the practices of traditional family planning among women who are working as sales, clerical, machine related workers and industry are 1.2. So traditional family planning practices by number of children, the odds indicated that traditional family planning practices among women having 1 to 2 children and childless women are correspondingly 3.9 times and 1.4 times higher than those who are having 3 or more children. And also the last one, the odds indicated that women's in highest wealth quintile, it means 1.237 times, and women lowest wealth quintile are practicing traditional methods than the women belongs to the moderate wealth quintile. Within the conclusion of my presentation, women's knowledge on family planning, women's level of knowledge, number of children, women's occupation and women's wealth quintiles are mainly influenced on practices of traditional family planning methods. Therefore, the revealed factors are strongly evidence-based and geared towards providing a contemporary, powerful solution for all the policymakers. So, consequently, the key female groups in need of contraceptive facilities and awareness can be targeted more resourcefully and effectively. So, as a recommendations, the Family Planning Association of Sri Lanka and Family Health Bureau and Ministry of Health can plan awareness sessions to be directed by medical doctors and midwives by targeting those women in reproductive age span in Sri Lanka and forming promotions and counseling sessions on modern contraceptive methods in different sectors and different fields, which we have to target men, ever married women, and also organizing all kind of media awareness campaigns to dispel the myths of surrounding modern family planning methods can be recommended. So thank you very much.